The medical community was at war with itself. Dr. Benjamin Rush believed the fever originated from local environmental causes, specifically that rotting coffee on Ball's Wharf. He championed the miasmatic theory, the idea that the air itself had been corrupted by putrid exhalations. His treatment followed the principles of heroic medicine. He administered massive doses of calomel, a mercury compound, and jalap to purge the bowels. He bled patients aggressively, removing up to 80% of their blood volume in some cases. Rush believed he was restoring the body's humoral balance. Critics believed he was killing his patients. The symptoms of mercury poisoning, fatigue, confusion, tremors, looked disturbingly similar to late-stage yellow fever. The aggressive bloodletting left patients weak, dehydrated, and unable to fight the infection. Yet, Rush's reputation was so great and his confidence so absolute that many followed his methods. The opposing camp, largely Federalist-aligned physicians, argued that the fever was imported, not local. They favored quarantine, isolation, and the use of aromatic deterrents. Vinegar-soaked handkerchiefs, tobacco smoke, garlic cloves worn around the neck. They burned tar in the streets, hoping to cleanse the air. None of it worked. A third approach emerged at Bush Hill, the city's makeshift hospital. Before September, Bush Hill was a nightmare. Overcrowded, filthy, understaffed. Patients lay in their own waste. The dead were left beside the living. But when Stephen Gerard, a wealthy merchant, and Peter Helm, a cooper, volunteered to manage the facility, everything changed. Gerard rejected Rush's methods. He implemented what he called the French method: cleanliness, fresh air, light nourishment, wine, and minimal medication. He bathed patients, he opened windows, he treated them with dignity. The survival rate at Bush Hill improved dramatically. Yet Gerard's success was largely ignored by the medical establishment. Rush's theories dominated the narrative. While the white elite fled, Philadelphia's black community stayed. Dr. Rush, operating under the false belief that people of African descent were immune to yellow fever, appealed to Absalom Jones and Richard Allen, leaders of the Free African Society. He asked them to mobilize nurses and gravediggers.
He was more than a
Jones
story.
and Allen saw an opportunity.
Bury the pain with him.
This was a chance to
earth
prove
hold
the civic virtue and moral worth of black Philadelphians in a society that denied them basic rights. The Free African Society organized hundreds of volunteers. They became the city's nurses, its gravediggers, its caretakers. They cleaned homes. They transported the sick to Bush Hill. They buried the dead when white undertakers refused. They performed the most dangerous, degrading work that kept the city from collapsing entirely. The myth of immunity shattered quickly. Black residents began dying in large numbers. An estimated 250 black Philadelphians died during the epidemic. But the volunteers kept working. Their sacrifice was met with betrayal. After the epidemic, Matthew Carey published a short account of the malignant fever, accusing black nurses of extorting wages and plundering homes. The accusations were false, but widely believed. In response, Jones and Allen published a narrative of the proceedings of the black people, a meticulous refutation that documented their service and expenses. It was the first copyrighted work by African Americans, a historical document born from the need to defend their honor. Meanwhile, Mayor Clarkson and a volunteer committee of 24 citizens took over the city's governance. They met daily at City Hall, managing care for the sick, burial of the dead, and care for orphans. Nearly 200 children were left parentless by the fever. The committee established an orphanage in the old Loganian Library, funded by a state grant of $2,000. By 1795, when the funds ran out, many of the surviving children were indentured to families. October was the cruelest month. The death toll peaked at over 100 people per day. The hearses and sick carts rattled through the streets constantly. You couldn't walk a city block without encountering a corpse. The smell of death was everywhere. bodies decomposing in locked houses, mass graves hastily dug outside the city limits. Elizabeth Drinker, a Quaker merchant's wife, kept a diary. Her entries are sparse, repetitive, haunted. She records the weather obsessively, hoping for frost. She notes every illness in her household with clinical dread. A headache becomes a death sentence. A flush of the face means the fever has arrived. The city lived in hypervigilance. People avoided heating foods. They watched the sky for signs of cold. They burned tar and sulfur in the streets, filling the air with acrid smoke. Nothing worked. The mosquitoes kept breeding. The virus kept spreading. The psychological toll was as devastating as the physical. The fear of death became a form of death itself. Dr. Rush wrote that the sheer negativity of the atmosphere could kill a person even without infection. Despair was contagious. Then, in late October, the first frost came. Within days, the new cases slowed. The mosquitoes died. The fever began to recede. By mid-November, it was over. 5,000 people were dead. 10% of the population was gone in just 3 short months. The survivors who had fled began returning in late November. They found a city transformed. Entire streets were empty. Businesses were shuttered. Hundreds of children were orphans. The government slowly reassembled, but trust was fractured. Those who had stayed resented those who had fled. The black community, despite their incredible sacrifice, faced renewed discrimination, but the epidemic forced change. In 1794, Philadelphia established its first permanent board of health. In 1799, the Lazaretto quarantine station was built on the Delaware River, requiring all incoming ships to be inspected before docking. Burial practices were reformed. Sanitation laws were debated, though enforcement remained weak for decades. The 1793 epidemic became a founding trauma of American public health. It proved that cities were vulnerable, that governance mattered, and that science alone could not save a population in crisis. The institutions built in the aftermath, quarantine stations, health boards, municipal hospitals, became the infrastructure of modern urban safety. But the scars remained. The political feuds between Rush and his critics never truly healed. The accusations against the black community poisoned racial relations for years. The families who lost loved ones carried the grief forward. Philadelphia survived, but it was never the same. The city that emerged from the fever was more cautious, more cynical, and more aware of its own fragility. It had learned what every great city eventually learns: that prosperity is temporary, that disease does not respect power, and that in the worst moments, survival depends not on wealth or status, but on the willingness of ordinary people to stay when others run. The fever of 1793 was a test, and the city barely passed.